Hi all, welcome to Physio Exam Buddy. This is the second video of the high altitude physiology and it mainly covers the acclimatization at the high altitude. Acclimatization at the high altitude or altitude tolerance. That is when a person ascends to high altitude and stays there for days, weeks or years, he slowly develops various compensatory mechanisms to increase his altitude tolerance, and this process of adaptation it is known as the acclimatization, and the maximum height up to which the adaptation occurs it is 18,000 feet. Under acclimatization you have to explain this question under these headings. So what are the principal means by which acclimatization occurs? There occurs a great increase in the pulmonary ventilation, increase in the number of red blood cells as well as hemoglobin concentration, increase in the diffusing capacity of the lungs, and there is an increase in the vascularity of the peripheral tissues and increased ability of the tissue cells to use oxygen despite the low partial pressure of oxygen. First, about the increase in the pulmonary ventilation. Hypoxia usually stimulates the peripheral chemoreceptors to increase the pulmonary ventilation, and if the person remains at higher altitude for several days, the ventilation can even increase to 5 times. And this immediate increase in the ventilation, it will blow off the carbon dioxide, large quantities of the carbon dioxide, decreasing the partial pressure of carbon dioxide, thereby increasing the pH of the body fluids, leading to respiratory alkalosis. And all these changes will causes the inhibition of the brain stem respiratory center, whereas this inhibition fades away during ensuing 2 to 5 days. And the causes of this fade in inhibition or the ventilation steadily increases over the next 4 days because of the outward movement of the bicarbonate from the CSF as well as from the brain tissues, as well as from the active transport of the H plus into the CSF and the lactic acidosis in the brain. So all these mechanisms can cause a fall in the CSF pH, which will stimulate the central chemoreceptors, increasing the ventilation. And after 4 days, the ventilatory response begins to decline slowly. And after years of residence at the higher altitudes, there is a gradual desensitization to the stimulatory effects of the hypoxia, and ventilation decline to the initial level. Next is about the increase in the diffusing capacity of the lungs after acclimatization. You know, the normal diffusing capacity for oxygen through the pulmonary membrane, it is about 21 ml per millimeters of mercury per millimeter, and this diffusing capacity it can increase at the high altitude, and this increase result from either due to increase in the pulmonary arterial blood pressure, which will force the blood into greater number of alveolar capillaries than normally, especially in the upper parts of the lungs, which are poorly perfused under usual conditions. Next reason is because of the increase in the pulmonary blood volume, that is increase in the pulmonary capillary blood flow. It expands the capillaries and increases the surface area through which oxygen can diffuse into the blood. And the next reason is the increase in the lung volume, lung air volume, which will expand the surface area of the alveolar capillary interface still more. Next, about the increase in the red blood cells as well as hemoglobin concentration during acclimatization. Hypoxia, it is the principal stimulus for increasing the red blood cell production. Ordinarily, when a person remains exposed to low oxygen for weeks at a time, the RBC count may increase to 6 to 8 millions per millimeter cube, and the hematocrit can even rise up to 60%. The hemoglobin concentration increases to about 20 gram per deciliter, thus increasing the oxygen carrying capacity of the blood. Next is about the peripheral circulatory system changes during acclimatization. In active tissues, exposed to chronic hypoxia, there is an increase in the tissue capillary density. This is because the angiogenesis will be initiated by hypoxia inducible factors, and the cardiac output often increases as much as 30% immediately after a person ascends to the high altitude, and it returns to normal within weeks. The blood flow to the heart as well as brain is also found to be increased during acclimatization. Next, about the decrease in the affinity of the hemoglobin for oxygen under hypoxic condition. The 2,3-BPG will be increased secondary to the alkalosis, and this will shift the ODC towards the right side, releasing more oxygen from the hemoglobin. Next is about the cellular acclimatization, the changes occurring in the cells. That is, there occurs an increase in the number of mitochondria, increase in the cellular oxidative enzyme systems, especially the cytochrome oxidase, increase in the myoglobin level. Therefore, it is presumed that the tissue cells of the high altitude in acclimatized human beings also can use oxygen more effectively than can their sea level counterparts. Other effects seen at the higher altitude are because of the effects of the reduced barometric pressure on the gases in the body. Next is about the effect of the temperature and effect of the light rays. First, about the effect of decrease in the barometric pressure on the gases in the body. The gases in the body, it increases in the volume in proportion to the reduction in the pressure. And this expansion of the gases in the gastrointestinal tract may cause painful distension of the stomach as well as intestine. And these effects can be minimized by supporting the abdomen by using a belt. Expansion of the air in the dental cavities may cause considerable distress as well as pain. If cysts are present in the lungs, it may rupture, and the pressure difference on either side of the tympanic membrane may cause it to bulge outward, producing discomfort in the ear. And one has to swallow frequently to keep the pressures equal on two sides. And next is very rapid ascent, that is very rapid aerial ascents from the sea level to over 10,000 meters may causes the gases to evolve as bubbles, resulting in the damage to the tissues. Next, about the effect of the temperature. With increase in the altitude, the environmental temperature falls considerably. Serious effects of cold injury as well as frostbite will occur if the body is not adequately protected by warm clothing. Next is about the effect of the light rays. Normally, many harmful rays of the sun, that is ultraviolet rays, are absorbed during the passage through the atmosphere. But at high altitude, the skin is more susceptible to the sunburn. The sun's rays reflected by the snow are also injurious to the eye. To prevent the adverse effects such as photophthalmia as well as photoretinitis, the eye should be protected by suitably tinted glasses or goggles. Next is about the natural acclimatization of the native human beings living at high altitude. They are the permanent human habitation in the Himalayas as well as the Andes, and they are born and brought up in these altitudes, and acclimatization of these natives begins in the infancy itself. In all aspects of acclimatization, these natives are superior to even the best acclimatized lowlanders who have been lived at high altitude for 10 years or more. The acclimatization changes are the chest size especially is greatly increased, whereas the body size is somewhat decreased, giving a higher ratio of ventilatory capacity to body mass. Their hearts are considerably larger than the hearts of the lowlanders, and the greater amount of the hemoglobin facilitates delivery of the oxygen to the tissues. Though the arterial PO2 in the natives at high altitude is only 40 millimeters of mercury, the quantity of oxygen in their arterial blood, it is greater than the blood of the natives at the lower altitude. And again, there occurs an increase in the hemoglobin level as well as there occurs an increase in the work capacity of the native acclimatizing individuals. So that is about the acclimatization. Thank you.